The first thing is that to give you some words about what about ESOP. ESOP is the European Society of Oncology Pharmacy. It's a society, maybe we are more than 20 years. Now it was created in the beginning of 2000. And at the beginning, the goal of ESOP was to, as a society, you know, to involve most of oncology pharmacists and to communicate together, to work together, to give. I think it's one of the pillars of the ESOP is to offer education, continuous education in oncology pharmacy, because we know that depending on the countries, it's a real needs from a lot of pharmacists to give the opportunity to work together, to exchange together. So that is the pillar of our society. So anyway, now the society grow more and more. And at the beginning, it was only some few countries in Europe. Now, in 23, we are ESOP is more than Europe, because we are also a lot of countries outside Europe, in Africa, in Asia, in America, South America, join the ESOP. And so we are now more than 70 countries for ESOP. And so it means more than 70 delegates. And it means that all the oncology pharmacists involved in the national societies, when they are in national societies of oncology pharmacy, it means that also they are registered in ESOP. So just to finish for that, what symbol term is unity in the diversity. I think it's two simple words that resume, I think, the best what is our philosophy, is to take in account diversity, because depending on the countries, we are not exactly the same kind of work. But anyway, we try to harmonize and to go forward in oncology pharmacy. And the second point is that when we are talking about oncology pharmacy, it means we are talking about all aspects of oncology pharmacy. So sure, classically, we are talking about production, preparation, for example, of chemotherapy, but what about quality insurance? That's very important to have that kinds of guidelines. We are talking about medical economy. We are talking about clinical trials in oncology. We are talking, and that's a field, an area with a very intensive development about oncology clinical pharmacy. For example, pharmaceutical consultations with patients and checking prescription, medication reconciliation, all the aspects of clinical pharmacy. And well, all these aspects. And another point is that we want to work more and more with our colleagues, oncologists. So we are building some very strong, we try to do that with strong relations with other clinical medical society. So that's ESOP now. And for example, and as a lot of society, what is important is that we try to have some big event. And so from maybe now it's a 6th ECOP. So it means that we are that Congress every 2 years. So it's more than 10 years now. And we are at the 6th edition. The first one was in Hungary. And so we are now in the 6th edition. The goal is to really to create a live event and not a virtual event. It's a live event where, if possible, a lot of people from a lot of countries to exchange, to discuss, to have the opportunity to have some continuous education about actualities and what's going on in oncology with new drugs, but also about workshops and interactive sessions for continuous education. For example, when a pharmacist wants to implement new activities, we try to organize a workshop to give the keys to implement that kind of activity. So it's a mix between classical, traditional learning with high quality speakers, I hope, oncologists or pharmacists, but also working sessions or debates from some topics where we consider there is needs to debate, for example, about what about new drugs, derogatory access, pharmaceutical package. So that's some example. Why we decide to do it in Lisbon? So maybe I can say we have a long history with our colleagues from Portugal. Since the beginning of ESOP, we have oncology pharmacists from Portugal, as in Spain, Italy, Germany, and Netherlands and France. So that's a very long history. And we have really, really interesting, friendly, and good working relations, because we know that in Portugal we have now, I think, because I was talking a lot with my colleagues from the national societies, and we have a very big development of, for example, of oncology clinical pharmacy in Portugal, and so we have a lot of things in common between what happens in Portugal and what happens in other countries in Europe. So that's one of the reasons we choose to do it. The first reason that they propose to do it in Lisbon. Maybe the second thing or third thing is that Lisbon is a very friendly and beautiful city, and so that was also an opportunity to do it in Lisbon, and very easy also to travel, to access from a lot of countries. From a logistical point of view, I think that was also important. That was not the first time, because we did some continuous education session in Lisbon in the past, not Congress, but and so we have a good memory about organization and logistical aspects. So that's a different reason we choose it in Lisbon. So what about now the ECOP6? So just I want to maybe to be sure it's clear. So why I'm now speaking about this Congress? It's why I'm the chair for the scientific committee for this Congress, and why one of my responsibility with the scientific committee was to propose a scientific program to identify which kind of topics can be interesting, to identify which speakers we would like to invite, and the organization. So Now, we are in June at that time. So the scientific program is definitely validated, is on the website of ESOP. So everyone can go to the website on ESOP and can see the scientific program. And you will see we have during 2 days and half from 2nd of October to 4th of October, Wednesday to Friday, during the first week of October. We will try to offer 2 days and half of, we hope, high quality and interesting oncology pharmaceutical things. It means some keynote sessions or lecture, a lot of things about immunotherapy in cancer. And we will have a very famous speaker from Lisbon, Professor João Gonçalves, which is a very famous speaker. But also, what about mRNA vaccines in cancer? And what about prostate cancer? What about breast cancer? So it's classical session. We will have also some more clinical and practical sessions about antibody drugs conjugates developments, because now it's there is more and more drugs in new kinds of cancer. So I think it would be very important. What about genomics? And what needs to know pharmacists about genomics? We have different sessions about gene therapy, CAR T cells in cancer, about productions, and what about surface contamination with oncology drugs. That's very important for all healthcare workers. We have a session about evolution of clinical trials, evolution of methodology of clinical trials in oncology. Session also with psycho-oncology, that's direct relation, how to speak with cancer patient. I think that there is a real need to know that better. Session in pharmacoeconomy, and we will have 2 joint sessions, one with the SIOP, with oncology pediatric in Europe, and one with IANS. It's the Society of Oncology Nurses, International Society of Oncology Nurses. Just to finish, we will have also some workshop sessions. So really it's more for continuous education. For example, management of drug-drug interactions, pharmaceutical consultation, therapeutic drug monitoring, or more concrete things, for example, how to write an article, how to present a clinical case, what about the way to work multi-professionally. It's also, we want to give some concrete examples for that. And at least we will have 2 roundtable discussion, one about derogatory access to new drugs. What about the landscape in Europe? Because we have different kinds of regulation depending on the countries. So we want to speak about ethical, economical aspects about that, and the added benefit of this kind of program. And one about the last year pharmaceutical package in Europe from the European community. So that's 2 roundtable discussion. And classically, that's very important. So we will offer the possibility to present some abstracts, and so digital posters, or oral communication. So that's very important for us, because we consider that's really an opportunity for the youngest one, but also for less young one, to show what about they do, what about their work in research or in practical. So it's very important to show that kind of scientific activity for all teams, for all countries. So I would say for all my colleagues from Portugal that it's possible. It's still time to submit an abstract. It will be possible until beginning of July. I think the deadline is 7 of July. So it means that you have still time, maybe around 3 weeks, to submit an abstract and poster. And really, really important to promote what you are doing during your work in research. And finally, just simply to say you go to register and to attend this meeting, because really it will be I think interesting and friendly opportunity to discuss. And when you come back after a congress at home in your hospital, I think you have a new kind of motivation, a new kind of stimulation from a professionally point of view. So that was, I think, the main messages. I hope also we are working with two of my colleagues from Portugal, Patricia Cavaco and Vera Pires, and they are also involved in the organizing committee, and they are also working about what about during the evening and the social program, and to find the best friendly environment to share together and to discuss together. So that was the main idea I wanted to share with all my colleagues from Portugal.